Hello everyone, good morning. I'm Dr. Surya. First of all, I would like to thank HCAP to give me the chance to introduce myself and share my experience with you all guys. I'm very much thankful to all the members who are connected with the HCAP and who made this event a successful one. And I was listening to till now. I listen to every speaker, and what makes this event a successful one is all of the speakers, these eminent speakers, are not only sharing their experience with you all, but they're sharing their this experience with you all. And most important thing here is that with all of this collective information to the fellow colleagues over there, it's a great opportunity, and it's a great kind of window for you all, that you can see a human body in a different way. And like Dr. Siddiqui, I was listening to everyone. So like Dr. Siddiqui said, it's a multidisciplinary approach which we really need to take care. It's a biopsychosocial model which we really need to work, because it's not only bone, muscles or fascia. It's about your psychological aspects. It's about your visceral aspects. There are multiple things which you really need to take care of when you're treating a patient. Acha guys, we'll make this session a interactive session. So when I ask something, yes or no, just type yes, why, no, n. So guys, the most important thing is, first of all, just tell me, am I audible to you all? Yes or no, y or n, quickly. Am I audible to all? Y or n? Yes or no? Okay, guys, let's start with my topic. So my topic is functional movement screening, and we'll talk about functional movements and all, and how it is important in our clinical practice. Thank you so much guys for responding. So why it is important in our clinical practice, and how we can make a very good individualized treatment program or an exercise protocol for a person, because everybody is different. And before I start my topic, okay, tell me if you guys are okay with Hindi English mix. Yes or no? Y or N? Great, I think. So we'll start with movement is medicine. Everyone knows that movement is medicine. Yes. So, but how? Medicine has a side effect. Har medicine ka ek side effect hota hai. Everyone knows that. So when we as a physical therapist prescribing any exercise or any kind of movement as a medicine to a patient, it is our responsibility to take care of the thing, that whether the person is capable of doing those exercises or not, उसका level क्या है, किस level पे exercises हमें उसको देनी चाहिए, and all these things. So now when someone prescribes medicine, तो उसमें सबसे important क्या होता है, what should be the dose, and just compare, like let's say medicine के जगह अब हम यहाँ पे exercise रख देते हैं. So I have my presentation ready, but maybe because of the technicalities, I don't know how to just share it on the Facebook page, but whatever is required, then I'll just flip my camera and show it to you what is important. So yeah, I was there. So let's say medicine and exercise. So let's say if we are prescribing a medicine or exercise, what should be the dose? This is what we need to take care. हमें ये पता होना चाहिए कि what should be the dose, how many times we are giving those exercises. Is the medicine good for patient? Whether the patient can take it or not, whether he is doing it or not. And the most important thing, as a physical therapist, as a doctor, your responsibility is to teach them, to train them properly how to do it. If, let's say, I was listening to Dr. Siddiqui, and very well, he rightly said that we have a lot to offer to the patient, but we don't know how to give it. And I think my entire topic is around that only, that our body works in the functional way. I heard Dr. Rohit functional movements, PNF and all these things. Dr. Senthil explained it so well, that if you are around bones, you are just working, you are a bronze medalist. If you are working around the muscles, you are gold medalist. And when we work on the fascias and patterns, that makes you an extraordinary doctor or extraordinary therapist. And I will slowly and steadily, combine all the data together so that I'll make some sense. Okay, so I think you got to understand that how exercise is medicine. So Now I'll start with functional movement screening. So functional movement screening consists of two major things. One thing is functional movement testing, and the other thing is corrective exercises to do that. In my webinar, today's event, I will just talk about testing. What I'm expecting from you guys is, after some time, maybe on HCAP page, maybe on my page, maybe on wherever platform you feel comfortable, you come with the ideas of how to make exercises, the corrective exercises, if there is any kind of compensation happening. Now, the main and the most important aspect of this screening system is that it functions to find out the imbalances between your right side of the body and the left side of the body. And everyone knows, if there is an imbalance in the body, there is a drastic change in your motor learning, the movement perceptions, body awareness, and mechanics. So when there is so much imbalances around the body, there are other factors which also involved in that. And that is why we need to test the functional movements. I know people are working with pain management part, experts in different kind of manual therapies, maybe chiropractor stuff, dry needling, suction cups, IASTM. But guys, understand one thing, that these all are passive treatments. You are doing some kind of changes in the structures, but in the end, the patient has to take care of himself. So what is the final stop? The final stop is to teach them the right kind of exercises which is important for him or her. And how to do that? When you do a proper assessment for a pathology or some kind of injuries or nerve problems or spasms or all these things, once you feel the person is getting better or pain is getting down, then that's the part where you are giving exercises. But again, before giving the exercises, it is the most important thing कि हमें exercises देने से पहले एक pre assessment करना ज़रूरी होता है, जिसे हम बोलते हैं functional assessment. एक तो हो गया आपका जनरल असेसमेंट, जहाँ पे आपने पैथोलॉजीज आपने डायग्नोज कर लिया, उसके हिसाब से आपने अपना एक पैटर्न चेंज कर लिया है. एंड उसके बाद आप क्या करते हो, यू गिव द एक्सरसाइजेज. बट जैसे ही आप एक्सरसाइजेज पे जाते हो, दैट्स द पॉइंट वेयर यू हैव टू असेस द पेशेंट अगेन कि व्हाट काइंड ऑफ एक्सरसाइजेज इज सूटेबल फॉर द पेशेंट. आई विल कम ऑन द एक्सरसाइजेज पार्ट ऑल्सो. सो now about the topic, the functional movement screening. It was basically meant and developed for the athletes, but as a physical therapist, as a practitioner, you can practice, you can use this score, you use this system in your clinic also to see how the patient is responding and what are the patterns and what are the imbalances in the body. What are the benefits now? The benefits are functional, improves the functional and athletic performance. It helps in reducing the potential for sports injuries, physical imbalances and weakness, to find out what kind of physical imbalances and weaknesses are there. It helps in design a good rehabilitation program, and the most important thing, tells us about the importance of quality movement and quantity movement. It's not about just कि आप 10 बार कर लीजिए, 3 सेट कर लीजिए, and that's it. It is our duty, it is our job to see whether the person is doing it in a right way or not. Now what I'll talk about is, I'll talk about a performance pyramid. This is how everybody works. Now, performance pyramid is basically construct to give a mental imagery and understanding of a human movement and human patterns. Basically, it consists of 3 rectangular pyramids. So it's a hypothetical pyramid, you can say. So from base, it's the broader, then slowly it goes up. So there are 3 rectangular pyramids, and each pyramid, each rectangular block represents a functional pattern. So the first pyramid is basically, I'll show you what exactly it looks like. So the first pyramid, this is how it looks like. This is the optimum performance pyramid. Body works in that way. So the first thing is functional movement, followed by functional performance, followed by functional skills. Now, the most important thing here is to understand is, when the patient is coming to us, we start from functional movement. So the first pyramid is the base and the foundation of this testing. Second pyramid shows the performance, how efficient a person is doing the exercise, or how effectively or how controlled he's having control over his movements. So जितना हम movements पे जाते हैं, जितना हम आगे further stages पे जाते हैं, उतना हमें पता चलता है कि problems कहाँ आ रही है और हमें किन चीज़ों पे work करना है. The last pyramid, the last block shows skills, and it is very very effective in those cases if you are treating athletes. So let's say a patient is coming to me and they are saying that I think you guys experience already कि मेरे पास एक patient आया gym से and they are saying like I am doing so many exercises, I have everything, I know each and every exercise, but still I have pain in my shoulder. What to do with that? Then that's the point where you have to see that what kind of stage you are first follow. So let's say you checked everything. So let's say I go with the pyramid. What I have seen is this: the overpowered performance. Now what I have seen is that guy was into exercises throughout the time. The efficiency and the power was good. But what I have found out is the movement was restricted. So it's my part to see that when I'm assessing a patient, it is the most important thing that when I checked the functional movements, power अच्छा था, but movement में the joints didn't have the mobility, muscle stiffness था, उसकी वजह से प्रॉब्लम आ रही थी इंजरीज में, उसकी वजह से कॉम्पनसेशन हो रहा था. So it hardly matters that you have a great power, but to generate that power you need the ranges, you need the flexibility in the body. So जब तक वो चीज़ें नहीं होंगी बहुत ज़्यादा मुश्किल हो जाता है to give a treatment program for the patient, because now in this case if you go for the strength training, he's already having a strength. Now this is the part where you have to see whether you want to go for a strength training or you want to improve the functional the mobility of the patient. Now in the second scenario, the same patient is coming and saying like if I'm doing some kind of things but still I have a problem, and you see that the problem is not in the power, not in the movement, but the problem was in the power. Now if I can show you how the underpowered performance pyramid looks like, it's like this. Now there are problems when you will see there is a lot of movement availability, but the person is lacking of power and movement control. Now this is the most important part where we all have to work on, that whenever you are assessing a patient, it's not about assessing one movement isolatedly. Like let's say checking the bicep strength or checking the quadricep strength. After some time, it will become a pattern. Like you have to train a patient into a pattern. So जब आप किसी भी एक person को patterns में convert करते हो या pattern में लेकर जाते हो, it is always important to do it in a synchronized way. How you are going to do it? In the sense, for example, if I'll tell you that let's say if I'm learning English, अगर मैं English learn कर रहा हूँ, I'll start from A, B, C, D, E, F, G, H till Z. Until or unless I will not have a better idea of the alphabets, मेरे लिए sentences बनाना बहुत ज़्यादा मुश्किल हो जाएगा, उनको merge करना. And like same way, body के लिए कैसे काम करता है? If I'm training the muscle, let's say I'm training glutes, and मैंने glutes train कर दिया, then suddenly I switch to another muscle like quads, then suddenly I switch to calf muscles, then QLs, then TA maybe. But what I am missing here is the link between A muscle to B to C. What I'm doing is jumping from A to C to D to P, which will not make sense. Body works in a pattern. Body understands the pattern. Body doesn't know what is biceps, triceps. Body knows bending, extending, side movements, rotations. And it always happens with the multiple movements. So जब तक ये चीज़ें आप sync में नहीं करते, जब तक आप body को इस तरीके से train नहीं करते, it is always tough to train a patient in a functional way. So when I'm doing this, when I'm assessing a patient, it is always important to first train a muscle, then whatever is connected to it, which will give me whether it is the synergists or maybe the supporter muscles. What we our main job is to train one muscle and side by side train the another muscle along with it, because once I will join A to B will make sense. It's not A to D will not make sense. So once you have a better idea of controlling and giving the exercises, then after that you can slowly sync one muscle to another to finish one complete pattern. And now what happens if the patient, this was the one part. Now the last part is when the patient is having a good range of motion, having a good performance, having a good power in the body, but it is lacking behind of skills. Now this part is majorly of either someone who is specialized in sports or coaches or trainers. They work on that. So combined sync with trainers and physios gives a very good result. If a sports person who's connected with some kind of sports like cricket or something, and they can also work on sports specific skills. Now, when we are on this part where we are working on the movement patterns, what is the second most important thing is? The second most important thing is mobility and stability. Now what happens, that's what I explained, I think. Now क्या होता है जब आपके पास mobility बहुत होती है but stability नहीं होती? I will take a basic example of hip movement. If I have a hip restriction, मेरे hip joint में major restrictions हैं. So what will happen is, to compensate that, my spine, my lower back has to lose the stability to compensate that. अब उस mobility के लिए जो restrictions वहाँ पे हैं, उसके लिए मेरी spine को compensate करना पड़ेगा. Now this is the most important part here, that while doing the functional assessment with the patients over there, you will get an idea which part you need mobility and which part you need stability. Working together with mobility and stability will give you a good treatment program or give you a personalized exercise program. Now, how to score these things? Like if I'm going for a functional assessment, there are 4 possibilities in that. Possibility 0 is that you score 0 when a patient says, I have a lot of pain in my body. Or whenever I'm doing a exercise or I'm performing some kind of movement, I'm feeling pain. Just straight away give 0. That the person is in pain, don't try to do that. Pain, score 1 when the person is unable to complete the movement pattern. Score 2 when the person is able to complete the pattern but with some kind of compensation. And score 3 is when a person is complete the movement pattern without any kind of compensations. These are the scores which when you're assessing a patient, then you can score it like that. Second thing is the most important thing here is that whenever you are assessing a patient, if you are in doubt that I don't know whether it is 2 or 3, just always score less. Don't score like मुझे लग रहा है it's 3, don't score 3. If you are in doubt, just score 1 less. Now there are 7 functional testings. There are 7 functional patterns which while performing on the patient you can get the idea whether the person is having any kind of imbalance in right or left. So the first one will start with deep squat. Now for deep squat, what main purpose of deep squat is to use it is used to assess a bilateral symmetrical mobility of hip, knee, ankle. Now in this case what you need is a stick. You need a stick in that case, because the way you have to perform it is you hold the stick in your hand like this in 90-90 position and you extend it fully up above your head. Now after some time, what you have to do is, how will you point this? I'll show you the image of this. How will you point out? So if a person is doing this, now most important thing in this case is that you have to see the components: ankle component, knee component, hip component, and the spine component along with your arm. Now the knee should not cross the toes. The knee pressure should be all over your toe, over your heel. The hip is going down below the knee, and the spine is parallel to the shin. If you can see, it should be parallel. Once the person is able to perform this, you can see, you can give the point number 3. Now second point is that if the person is not able to do that, you can use a tool like a plank kind of thing to give a support to the heels, and then try to perform the same exercise if he can do it or not. That's point 2. And point 1, he's unable to do that. You can see a lot of compensation. So it happens when there is a restricted dorsiflexion in the ankle, or there is a lack of hip mobility. Then that time you can see a lot of compensations happening over there. Now, second thing what you have to see is that how your back is responding in that case. Agar back mein stability kam hai, the back will compensate. Now that what will happen is pushes the thoracic, if the thoracic mobility is also less, it is pushes the hand forward. हाथ दोनों आगे जाएंगे, and that will show you how that if there is any kind of dysfunction, and it can create a dysfunction on your shoulder and neck region. Now, second thing is the second test we are going to perform is the huddle test. Huddle test mein you will not only see the hip, knee, ankle mobility, but also see the balance of the body. And this will show you that I'll just show you the image. Now in this case, how you can perform this, and these are very easy tests which you can perform it in your clinic also. Now how you can perform it, that you have to make a huddle over there. The mark is just around your tibial tuberosity. Itna hi height hona chahiye. Then what you have to tell is you need a stick for that. Hold it over your shoulder. And jab aap ye perform karoge, it should be parallel to your huddle stick. There is no movement happening, there is no compensation happening, spine mein koi shift nahi hai. That is score 3. But if you can see a score number 2, see the hip angle. There is slight rotation over there. You can see that there is a slight shift in the spine also. But in point 1, there is a lot of compensation happening, not only in the lower aspect, but in the upper torso also. Now that is the most important part, where you have to see that in point 1, that the person will not only feel the lack of movements or mobility, but he can also experiences imbalances. So when he'll lift the leg, you start seeing the patient is wobbling too much. Then, and again I'm repeating the same thing, that if the patient is saying that I am feeling pain, then you have to score 0. Now the third test we are going to do is inline lunges. Very important, very effective test to do it, but there are some kind of technicalities in that when you're performing this test. So how to go about it? Again I'm saying, so these all tests are focusing on not only the mobility but also stability of the body and how the body is compensating with that. So at least perform 3 times these tests. So next is inline lunges. So for inline lunges, what you have to do is, if you can see these pictures, before you can use a plank, or what you can do is make a mark. So the mark should be 2 by 3, 2 foot wide and 6 feet long. Now before you go for this test, the most important aspect is that you have to measure the tibial length with your इंची टेप. इंची टेप से tibial length measure करिए आप. उसके बाद जो आपने मार्किंग बनाई है 2 by 6 की, और या फिर अगर आप प्लैंक यूज कर रहे हैं, just put 1 step over it. Then from that 1 step, from the toe, जो भी tibial length था, use the इंची टेप, use the measuring tape. आप एक मार्क लगाइए जितना भी आपका tibial length आया था, from the toe to the front, जितना भी आगे तक वो tibial का length था. Mark it over there, and the second foot का जो heel है, it will land over that mark. So that is the point where you are in line. And after that, what you have to do is you go down, and from the back knee touch the plank. So जब आप plank को touch कर रहे हो, that is what is a 1 repetition, 1 movement. Now in that all scenario, what all you have to see. Now second thing, which is the most important thing, is because we have to see the spinal angles and spinal alignments also. So I'll use a stick, or I'll give a stick to the patient to hold it like this. अब जो मेरी back leg होगी, वो वाला same side ipsilateral hand will hold the stick from top, और जो front leg होगी, that hand will go down. Now I'll show you the picture how it looks like if you're performing this test. So a person will be absolutely in line. If you see this, the spine is in line. You will see less or no compensation on the back. Heel, your knee is just behind your heel, and that angle of the knee is in line with the plank. Now in point 2, just check that the spine is in line, but you can see a compensation around the knee. That's the compensation which we are checking. So that what will show is the tight hip flex, the rotators, or there is kind of restriction in the hip area. And in third, the problem will not only in the movement, but also with the stability. Am I audible now? I think someone wrote that the sound is off. Am I audible now? Now, the next one is, because these are the functional movement, these are the functional patterns we are talking about. So everything what we are doing is a combination of movement, so that you can see where the imbalances are, where the muscles are tight, where there is instabilities, so that you can make a right protocol for that. Now the second one, the next exercise or the next test we will do is for the shoulder mobility. Now for shoulder mobility, again, for this I'll need a stick. It's a combination of internal rotation and abduction of the arm, internal rotation and abduction, and external rotation and adduction. This is what a combination is. It's basic movement in which what you are checking is the distance between your fist. Now how you can check the movement is, I'll just show you this, how you will check the functional mobility of the shoulder is if you have to tell the patient to do this movement. So you can see that there is an internal rotation and adduction on one side, external rotation and abduction on the other side, and you are trying to make a fist and take it as close as possible towards each other. Now the most important thing what you have to see is how you can tell it's a 0.3. You have to make a the hand length, you can say. So if this is the length, you have to keep it in between and see how much difference is there. So approximately it's one hand, and you check. If that is the difference, you can give it 0.3. If the distance is more than one hand, or you can say almost around 1.5 hand, then you can score 0.2. And in third, you will see a lot of difference between the mobility, and it's not only one side you are doing it, it's on both the sides. So right and left, you are performing it to see which side you will find the shoulder imbalances or restrictions. And that will give you an exact idea to how to work and on what part you have to work on, like what all muscles I need to release and what all muscles I need to strengthen. Now the next test we are going to do is active SLR. I know active SLR is quite common in our field. Everyone is doing it. It's not only a functional testing, but also to check a sacroiliac dysfunctions, or sometimes go for a neural testing and all these things. Now in this case, how active SLR is important, because I think when we are doing a neural